Today, I will talk about weight-bearing joints. I'm sure all of you have concerns about that. And when you understand the purpose of weight-bearing joints in our body, you also understand we always have problems. Okay? So with that, we begin. Let's start off by trying to understand what is terahertz waves. Terahertz waves have a certain frequency from 0.1 to 10 terahertz, which is about 10 to the power of trillion. This is trillion, 0.1 to 10. So it's part of the electromagnetic spectrum. The electromagnetic spectrum includes visible light, ultraviolet, which you get when you get sunburn, infrared, which you get when you have heat, bonfire, anything that produces warmth. So what is it used for? It mainly used in telecommunication. Any of you use 5G mobile phone? You have. So that's used microwave. Frequency is the same. Now, 6G is coming, right? You've heard of that? 6G is terahertz wave. So it's primarily used in telecommunication. And the interesting thing about this is that our human cells, you know, everything has a vibration. You heard of singers who say crash a glass. So if the vibration is the same, it falls. So our cells also have a frequency. That frequency is terahertz frequency. By chance. Maybe not by chance, because that's what nature is. So that's where terahertz is. Terahertz is in this band, this greenish blue band. Here is infrared. Actually, terahertz is infrared. Strictly speaking, terahertz is far infrared. So this is called near infrared. That's the one we go infrared saunas, that's what we get. There's another narrow band here called the mid infrared. And terahertz is actually far infrared. Beyond this is microwave. Beyond microwave will be radio waves. That's how we can listen to the radio, watch television and all that. On this side of the visible light spectrum is ultraviolet. This part is very dangerous. Too much of it, your human cells can take. Chromosomes change. So it is very dangerous, okay? And normally we don't have too much ultraviolet radiation, but infrared is technically very safe, alright? So the problem with terahertz is that we don't quite understand it until the 1990s, when there is a breakthrough in understanding terahertz waves. In the 1990s, new techniques were developed to create terahertz wave, to monitor and to detect terahertz wave. So because of that, we have a better understanding. So 2011 was a breakthrough where you know that very old paintings, because of the lack of painting material, they tend to paint over older paintings, right? So they took a painting and they looked at the painting with terahertz waves, and they discovered there was another painting underneath, and the older painting was painted in 1771 with the name of the artist clearly seen with the terahertz. So that was a breakthrough. It can see through things. So before this, there was what is known as a terahertz gap. The terahertz gap explain why we don't know much about terahertz until recently. On this side are microwaves. We use electronics to study microwaves. On this side is visible light. So on this side we use techniques to measure light study. So it's called photonics, right? So this side is photonics, this side is electronics. Terahertz sits right in the middle. So we don't know what to do to study it. If you are up to date with the news, you know that in China they're experimenting with photonic chips, isn't it? Right? Currently, microchips are all here. Electronic. China is looking at chips that are made to respond to light, photonics. So this is the difference. So why do we use terahertz for? In this day and age, it can be used for many things. Primarily in telecommunication, in 6G as we said. And some months back, there was an article that looked at 6G or terahertz waves, whether it's safe for us. Remember, at one time, mobile phones were said to cause cancer, use too much of it. So they were very concerned whether terahertz would cause this. And they found that terahertz is very safe. So it's used in the military as is for security applications. You know that when you go through immigration and customs, you go through scanners that scan your body, right? Terahertz can be used for this purpose. In fact, it's the most accurate because it can really see through a lot of things. And it's also used in, look inside plastics, textiles and all these things, especially, and in agriculture, it's used in drought monitoring. Now, terahertz is absorbed by water. So any water there they can detect. So I read up on how they use it in agriculture, and it seems that in China what they do is that they use terahertz to scan plants, and if the plant's moisture get reduced, a drought is coming, and they take action. So it's quite an amazing application. And of course, health and science, there's application because it resonates at the frequency of the human cell, like I said. So because of this, terahertz is a frequency that is very close to the human body, and therefore it can be used for biological purposes. That's why it is the light of life. So where does the healing property of terahertz come from? From two things. The healing property of terahertz come from one, the heat. We say that it is far infrared. Infrared on say a campfire, you feel the warmth, you feel the heat, right? So it shares the same property as infrared. The heat can penetrate, can go in and stimulate water molecules, push out toxins and all that. But another way terahertz heals because the vibrational energy. And so how do we know? Because there have been a lot of experiments where they take a look at the effect of terahertz waves, okay? And how they prove that it's vibration, they remove the heat. So all you have is a vibration. And when you focus it on the body, just the vibration alone without the heat, there still is an effect. So we know that the effect comes from the vibration, okay, not just the heat alone. So the medical applications, there are two, because you can see we use it for diagnostic. In fact, there's a lot of research papers on how terahertz waves can be used to examine your body, to look for cancers, to look at bones. See, it's so sharp and accurate that it can, in your bone, they can detect 3 different layers.
MRI.
Huh?
They're using MRI.
No, it's not used in hospital at the moment. It's in the research stage. Some hospital may start using it.
I'm asking, is it the same as MRI?
Different rays. Therapy devices. Therapy devices are what we use here. All the devices that you see can be used for healing purposes. So the properties of terahertz are very interesting. Number one is low energy. It doesn't cause your cell to mutate. In other words, it doesn't change your cell. So it is very safe. That's number one. Extremely safe. It penetrates through all these things. All material with dielectric property. Dielectric property simply means, it's a technical term for saying that it is a non-conductor. Anything that don't conduct, your clothes, whatever you wear, your shoes, walls, wood, anything that doesn't conduct electricity, it can penetrate. It is absorbed by polar compounds. Polar compounds are conductors of electricity. Water can conduct electricity, right? So water will absorb it. And the energy, if you know physical chemistry, the energy is very, very small, called van der Waals forces. Van der Waals forces are very weak energetic connection. Why terahertz water is better than ordinary water? If you pour water out of a glass and you put it upright again, you find there's still water there, isn't it? Water seems to stick together. They stick together because of all these bonds and van der Waals. So what terahertz does is to break all this up. When you break all these forces that bind molecules of water together, they become very fluid, isn't it? They can penetrate deeper, isn't it? They can go through. So that is the difference between terahertz water and ordinary water. So terahertz can also change the shape of molecule. Now, if you take any complex organic molecules, that means molecules used in plants and like proteins, like carbohydrates, they are all very complicated structure. They are all held together by this force. Since terahertz is able to pick up this force, it can therefore change the shape of molecules. And because human cells resonate at this frequency, it has an activity on a lot of human cells in our tree. That's how it managed to regulate. So let's go through. What is the effect of terahertz on the body? A brief summary: it opens up blood vessels, increase circulation, and remove weight. It causes water molecules to vibrate. It causes cell structures in the cell, the organelle. This thing called mitochondria is the factory of the cell because it's activated. And cells that are hyperactive, for example, if you have an inflammation, kind of calms it down. And there's an effect on DNA. It can unzip DNA. I'll explain what it is. So this is what it does to your blood vessels. Your arteries come from the heart, which is under pressure. So it's in the arterioles, and you reach the tissues, water, nutrients, oxygen, all leave this because it's under pressure. Then when you reach the veins, all the waste products, all the carbon dioxide get into the veins to go back to the heart to be excreted. But this is not under pressure. So not all waste products, not all the water get into the veins. So you need another drainage. That's where lymph vessels come in. Lymph vessels collect all the excess water and they return it to the heart. So terahertz is able to open up all the blood vessels. They open up the arterial, which means that your tissue get more nourishment, more oxygen. They open up the veins. That means the waste products can get removed. Now imagine if you are diabetic and your legs that are swollen and red and all kinds of things. When you have more nutrients, when all the waste products can be removed, you heal faster, isn't it? So that is the effect. So irregular inflammatory response. In other words, in the blood there are cells. These are white blood cells. How it looks like. They are the ones that attack whenever there is a foreign substance in your body. Sometimes it can attack your own body cells because of some mismatch of chemical signal. When that happens, all the white blood cells begin to accumulate in that part of your body. So Terahertz can calm it down, you can reduce it. How it does so is much more complicated. There are a lot of what they call cascades, in other words, reaction in various parts that calm down the biological tissue. So these are subcellular structures within a human cell called mitochondria. They have many functions. They do all the work, all the chemical work that allows you to be alive. For example, translate gene into making proteins, give you energy through this. Okay, it's an energy pathway. They can get rid of waste products, protein quality control and degradation. Mitophagy is any waste or any cell, parts of cell that are dead or not useful anymore, they got eaten up. Swallow up and that weight change to the waste. Transport. You need water, you need ions, you need metabolites, so these are transport. So this mitochondria is a very effective part of your cell that cause you to be alive and function properly. Okay, so all cells have a cell life up to 120 days. At the end of your cell life, they are broken up, and as they get broken up, those particles send out signals: find me, eat me. They got swallowed up by certain white blood cells that kind of engulf them and digest them. So every 3 months you got a new body because all your protein, all your substances are new. They are renewed all the time. Okay, so it hastens this process, and therefore you feel fitter, you feel more energy. One effect of growing old is that this slow down. When this slow down, that means your cells that should have been removed are not, and so there are a lot of waste products. So this is one reason why things slow, things happen, accidents happen, all kinds of things happen in old age, and all because of this aging process. Okay. The other thing about terahertz is that things that are foreign to our body, parasites, viruses, bacteria, will be eaten. So it's effective even in bacterial infection. In fact, that's how I discovered Terahertz. During COVID, and they've been using this for COVID patients with lung problems and blowing it, and they improved. Remarkable. And subsequently, I learned that it can kill other bacteria, viruses, fungus. So you have any infection of your skin, whether it may be, you blow on it, it will get better. And that's in fact what people find, in activate DNA. This is a very interesting part. DNA, you may know that DNA exists in pairs, right? Now when they exist as a pair of DNA, nothing happens. When you need to create more cells, you need to duplicate the DNA. So you duplicate by unzipping the DNA and then making another strand inside. That's how they make duplicate DNA. The other thing is DNA give you information as to what proteins to make, right? What things to do. So this is something like a printer. It's an RNA printer. It reads the information, code it, and then it goes to another part of the cell to be, the instructions will be read, and then the protein or whatever it is created using this instruction, right? So this is a very complex but very interesting way whereby the body is able to renew itself. So today we are talking about weight-bearing joints, how Terahertz can help us with the kind of problems that we have with our weight-bearing. When we talk about weight-bearing joints, what do we mean? The joints that bears our weight. Primarily, these are the joints of the leg, hip, the knee, the ankle. Ankle usually goes together with foot because it is like a complex. Secondarily is your spine. Most important is the lumbar and the cervical spine. And particularly this joint here at the neck called the atlantoaxial joint. Now the spine is important. You notice that the thorax is not there, thoracic spine. You know why? The thoracic spine is joined together by ribs, isn't it? So it's a cage. It's literally a cage. Together with the ribs is a very rigid structure. So the thoracic spine do not move. It is like, because it's a cage, it functions like a cage. So it's one whole. And the ribs keep your vertebrae, your spinal bones apart, isn't it? Cannot come together because the ribs maintain them at a certain distance. But in the neck and in the lumbar spine, there is nothing to keep them there. So that's why you can move your leg. That's why you can move your back, and because of that, that's where problems start. And of course, there is a pelvis. Pelvis, I'll say some things about it later on. Now, besides bearing our weight, joints are important for movement. We can move, we can walk, we can do things with our hands and our legs. So it fulfills many purposes. Like the joints that bears the most weight is what is known as a femur. Do you know which is the longest bone in your body? Do you know which bone? Yeah, the femur. That is also the bone. It is the longest and bears the most weight. And because if it bears the most weight, the joint above and the joint below will be the joints that bear the weight, isn't it? So the hip and the knee, right? So although the ankle also bear a lot of weight, but the ankle is not a joint that is in contact with the floor. It's in contact with the floor through the foot, right? So you have a larger surface whereby the weight is transmitted to the floor. So that's why ankle injuries, yes, you get, but not as much as the knee and the hip. As we go through, you begin to understand. So the wear and tear is aggravated by two things. Body weight, so the bigger you are, the more obese you are, the more weight your joint has to bear. So one of the two things we advise people who have problems with their joints is to reduce your weight because when you reduce the weight, reduce the force on the joint, isn't it? The other thing, of course, is injury as a result of things like movement and contact sports. Contact sports are things like football, basketball, soccer, all these things, because there's movement, isn't it? And when there's movement, that's where you get accidents and injuries and all that, correct? And because of all these things, it wear down the cartilage. Your bone is covered by a layer of cartilage. It's like a cushion. So it's old cushion becomes rather flattened, isn't it? If you're old cushion. And that's what happened to your cartilage. It got flattened and it can disappear. So premature arthritis, there's also soft tissue damage. Because if there is an injury, if it's a fall, there's an accident, or even ordinary walking, people like hawkers or salespeople who need to stand on their feet the whole day, right? They have soft tissue. So the other thing is, actually there is one joint which is not weight bearing at all, which injured the most. That's the shoulder joint. Because the shoulder joint, people always use the shoulder, isn't it? When you want to fight, the shoulder is always there. Leading joint, it is also the weakest. That's why a lot of people have dislocation. Even I myself, through bad golfing habits, have what they call a subluxation. Subluxation is a partial dislocation. Now using this is so much better. So, and together with this, there's always soft tissue injury that involves the muscles, the tendons, the ligaments, and all that stuff. So this is what we will cover. You get some idea of what it is. So let's look at it joint by joint. The hip, it is multi-axial. That means you can rotate your hip, isn't it? If you have done exercise, you know that the hip has a lot of motion. It's a ball and socket joint. A ball there and a socket over it, so it can really move. Movements include a lot. Flexion is this way, extension is that way, abduction towards the center, adductions away from the center, circumductions, draw a circle and rotate. It provides balance and stability. That is a function of the hip joint. That's what it is. This is a ball, socket. This is the head of the thing. And notice there is a ligament connecting the ball to the socket. And there's a lot of ligaments surrounding it. And of course, there's also a lot of muscular tissue surrounding it. They connect. And in fact, the muscles that connect the hip to the tailbone and around form the bottom of your pelvis, which support your urinary structure as well as your reproductive organs, right? And people who have problems with their urine pass too frequently or can't pass, often there are problems with it, what is known as the pelvic floor. The hip form the basic structure to support the health pelvis. So you can see how important pelvis is, the hip joint. Now, what are the injuries? Labral tear. Labral is this part connecting the femur, the pelvis. This is a labral. Stepping hip when the muscle is weak, and then it kind of snapping motion. Then another muscle that is weak is a femoral acetabular impingement. This connects the bone to the pelvis. Then bursitis. Now you know that when the joint moves, there's bound to be a lot of friction. So the body has created balloon like a sac, a water bag inside our fluid, and this can get inflamed. These are called bursa. When they get inflamed, the bursitis. So sometimes a joint may feel painful, and everything seems to be normal, but you still have a lot of pain. So it could be bursitis. Then the muscle surrounding it move the joint, right? So when the muscle strain, there is also pain. Then of course, if you move about, if you get accidents or injury, your joint can dislocate. That's what it causes pain. Stress fracture. As you get older, you get osteoporosis. That's what you get. So there you are. Your labral tear, this muscle weaken. This muscle connect on the bottom. So this muscle is for that movement. You can understand why this will snap. So these are the muscles that this part. For example, this is part on the top of the hip joint. This is a bursa, right? It kind of allow you to cushion when you make various, and this bursa can sometimes cause problems. And some people feel that pain there, isn't it? You find that's good. Okay, so dislocation, you see, completely out of the joint. This is still normal, but this is affected by osteoporosis. So on X-ray, this is completely. This also there is a fracture. Notice that? When you get old, then one day, probably in the night, you get up and then you fall, and then you can't move, you send to the hospital and they tell you have a fracture, neck or femur. It's not that you fall and get the fracture, it's that you get a fracture and then you get a fall. It's the reverse. So let's take a look at the knee joint. It's the largest joint in the body. Very complicated joint. And it's the most powerful joint. You look at footballers and see the way they kick, a lot of force, isn't it? So this is a very important joint. Although the movements are a little bit limited, flexion, extension, then rotate, rotate inwards, rotate outwards. There's a rotation. Knee joint is like a hip, flex and extend. And the cartilage, you have many types of cartilage. You all heard of meniscus injury, right? People tell you, I have meniscus injury. Usually footballers or people who have accidents. The meniscus are shock absorbers. So if you have driven a car when the shock absorbers are gone, you know what happens? It's terrible, isn't it? Imagine your knee joint, the shock absorbers, which your meniscus torn completely out, and you got to remove it. Something called meniscectomy. It makes it even worse without shock absorbers. So that's why the thick meniscus and the ligaments support your posture, your stability. This is terribly important. In fact, if you ask all elderly people, they have some degree of knee injury, if not hip injury as well. So this is particularly important. So soft tissue, torn meniscus, ligamental tears, posterior cruciate, patella, that is the bone in front, tendinitis, tendonitis, and bursitis location. Let's go one by one. Torn meniscus. Now, meniscus is particularly important if you twist. And which sport makes you twist your knee most? Football, isn't it? Or soccer, right? That's why a lot of soccer players end up with meniscus injury. Because sudden twisting motion. They twist the motion to hit the ball. They are moving in this direction. The ball is forcing the knee to move in another direction. Now you can understand why the meniscus sometimes get torn, isn't it? It got torn because of opposing force. Or if you are injured, you try and hold on to something, and the force that's causing the injury is pushing against it, of course you got a torn meniscus. Two opposite forces impinging on your meniscus. Something must give way. So it got torn. Ligaments, there are quite some ligaments in the knee, and there's the posterior, there's a cruciate. Cruciate, as the name implies, cruciate means cross, right? The ligaments in the center, they are crossed. It functions together with meniscus to give your knee stability. So again, these ligaments are also caused by rotating forces that come about when you try to move your knee in a rotating manner. So around the knee, of course, there are lots of muscles and tendons. Tendons are the part of the muscle that get attached to the bone. So all this can cause problems. Bursitis explained to you, those sac that allows you to hit, and of course knee dislocation. Knee dislocation is not as common, but it does happen, and of course stress factor. You see that in elderly people. So now you see your meniscus is a shock absorber for your knees, right? This is a shock absorber. So in the meniscus, what are the kind of injuries? Incomplete tear. This is the shape of the meniscus. It's a C-shaped thing, round, sit between your shin and your femur. A radial tear in this direction, or a horizontal tear, a bucket handle tear, like a handle of a bucket. Complex tear or flat tear. So different kinds of tear. Why they describe it this way is that so that the surgeon knows if they need to repair your meniscus, if they need to stitch this thing together, they know whether it can be done or not. This is very hard to be stitched together. This is also very hard to stitch together, but this will be easy to stitch together. This will be easy to stitch together. You see? Look at the ligaments connecting this. Hold it together so that it's stable. This is the cruciate. Cruciate is here, like a cross. From back to front, front to back, like that. And of course, twisting motion will affect. So when ligaments are affected, it's very. That's why a lot of knee. That's why it's so complex. Because besides all this, you must also understand the various muscles. On top of this, your knee bone, your patella, is the tendon of your quadriceps, your quads, is attached to here, right? And often this gets injured. A lot of people have patella problems, kneecap problems, and if you get out of place, it can be very painful. The patella hold the muscle in place as you move because it's movable. When it's straightened and when it's fully flexed, your muscle moves. So the patella keep it in place, in position, and when this gets inflamed, it's very hard to move. You can't even kneel down. That's how bad. So let's look at the ankle joint. It's a joint where the shin bone, the tibia, and the fibula meet the talus bone. Talus bone are the bones of the foot, and it is surrounded by a lot of soft tissue, cartilage, ligaments, muscles, and nerve. Key function is provide you with stability. There's not much movement in the ankle, right? You can move up and down. Yeah, you can move sideways, but that's about it. The sideways movements allow you to do quite something. But the side wave movement are also the one that cause you the most problem, because sudden side wave movement are the ones that cause people a lot of sprains, right? A lot of people complain about that, isn't it? Yeah, so movement, plantar flexion, dorsiflexion, inversion, eversion. The muscles of the legs are in 3 compartments, and the muscles are there to facilitate the different movements of your ankle joint, right? And when you twist your ankle inwards and outwards, pronation and supination, they occur at the joints of the foot. That's why it's considered as a whole. The foot and the ankle is considered, because it acts like a system. So it's the subtalar joint and the mid-tarsal joint. You see, so the joints act as shock absorbers, especially when you walk. When you walk, your heel go down first, isn't it? Then the whole foot, and then the toes. The heel strike the floor first, and so everything supports the body, especially your arch. How important the arch is, you only know if you don't have the arch. Anybody here have flat foot? Or you have? Okay, good. Do you know what kind of problems flat foot can cause you? Yeah, what? Unbalanced. Not only that, do you cause it give you other problems? Like
pain, tired.
Yeah. Any other joints affected?
Yeah.
You see, ladies who wear high heel shoes and people with flat foot will know that any problem there get transmitted upwards. You got problems in your knee, your hip, your spine also. And because of the weakness, you fall very often, right? Yeah. You tend to fall very often. You tend to get injury. So if anybody you know has flat foot, ask the person to take it. Wear proper support. There is a movement that encourages people to walk barefoot. It's a good practice. It kind of allows your normal arch to be exercised, to exercise all the smaller joints of your foot, right? And if you protect your arch that way, you should be healthy. And in some way that is correct, right? Last time we don't wear shoes and we're alright. But when people start to wear shoes and the arch is supported, we don't exercise that. Or as you get older, it gets weak, right? I never wear arch shoes until I was past 60 years. Then I realized that if I don't wear arch shoes, it gets very uncomfortable. So I start wearing arch shoes, even though I never have flat foot in my life. Because as you get older, that's what happens. You understand? So this is what we mean when we say that the ankle and the foot are one and the same thing. It's one system. Especially when you walk, you realize there's a complete system. You can walk properly, heel, foot, toe, right? It's a complete system. So let's look at okay, the injuries. Sprain is probably the most common. Almost everyone will have it at some point. Plantar fasciitis. Now beneath your leg there is some soft tissue connecting, fibers connecting all the various joints, hold it together and give you that arch. When it's inflamed, it's called plantar fasciitis. So you have pain at the foot. So if you have that pain, you go and see a doctor. There's nothing wrong. It's just plantar fasciitis. Take medicine, allow it to heal, get the inflammation down and things. So tendonitis, any muscle, the end that connects to the bone get inflamed, you get a tendonitis, and it does occur in the ankle and the foot region. One tendon that always happens is Achilles heel. The back of your foot, the Achilles heel, that can often be painful. And ankle and foot sometimes can be fractured through injury or accidents. And of course, when they are fractured, you need to seek proper attention. Nothing much can be done. You've got to wait for the fracture to heal. Take a few months. So these are the kind of injuries you see the ankle. Not as severe as the hip or the knee, because as I said, it's a whole system, but it does happen. I don't have a picture, never mind. The pelvis. Pelvis is formed by a lot of bones together. The ilium that form the pelvis crest. Right? That's the bone you can feel on your side. Then the sacrum with 5 or 6 vertebrae. They are fused together. It's one solid bone. And then something in front you can feel called the pubic symphysis. So all this together form like a pail. Of course, no bottom. The bottom is formed by your muscle. It articulates with the abdominal part, the lumbar spine, and it connects to the hip joint. So it transmits the entire weight of the body, head, thorax, everything, your legs. That's what the pelvis does. There's not much movement of the pelvis because it provides stability, strength, and they function as shock absorbers. Your pelvic bones get fractured only in accidents. Accidents happen, and particularly road traffic accident where there's a force hit your pelvis and it fractures. So that is a very important cause of disability. And pelvic fracture almost invariably affects the reproductive and the urinary system that is in that region. So the sacrum here is a solid piece of bone. The ilium is a pelvic girdle, and this is a pubic symphysis. This holds your pelvis and protects your reproductive organ as well as the urinary system, and as well as the lower part of your large intestine, the rectum. And so here, a lot of nerves, blood vessels pass through the pubic arch. In between is where your sexual organs are. So because the female can deliver babies. So the pelvis of the male and the female are different. You notice that the female, the pelvic circle, large enough for the skull of the baby to go. So people with polio will have difficulty because the bones are not shaped properly. So this is what the pelvis is all about. Now, let's look at the lumbar spine. It supports the weight of the body. There are about 5 vertebrae. People think of the vertebrae as having one joint between one vertebrae, right? Where you have the disc, and people talk about prolapse disc. Actually, between 2 vertebrae, there are actually 3 joints. Why there are 3 joints? In between the intervertebral disc, this joint is held together by it doesn't quite move. But the 2 facet joints by the side, near where the nerve come out, these 2 allow for movement. And that's where each bone come into contact with other bones, and that's where rotation. So movement is possible with walk, sit, run, so forth. There's a rotationary movement. So the muscles of the spine protects your spine, but things can happen now. So at the side, these are what is known as a facet joint and the facet capsule. This is what people normally concern about. These are the facet joints, sit on one another. Again, these are the facet joint, left facet joint, right? Okay. So when you understand this, you understand how complex things can be. So neck, the intervertebral joints of the neck, they're similar. They support the weight of the skull. They allow for movement all around. Movements also allow blood to flow into the brain, and also for nerves and blood vessels. Very prone to injury, fracture, the neck and the spine. Whiplash injury common, and this in fast-moving vehicle. Stop suddenly, and there's a special vertebrae at the base of the skull. Now at the base of the skull are 2 joints, two vertebrae. The first vertebrae is called atlas, and the second one is called axis. It's a pivot joint. That means it's a kind of movement in one. It allows for nodding, moving upward. It also allows for rotation, and is surrounded by membrane to limit access. And your whiplash injury has to do. So this is the first vertebrae, the atlas. Your skull sits on these 2 points. This is the second one. The second one is like the axis has a process that stick into upper one, so the whole thing looks like this. So you have a rotation movement like that. It is the fact that the atlas sits on the axis in this way that allows. So it's a very interesting joint in that regard because it's really made for rotating the head. So whiplash injury come about because when the car move very fast, stop suddenly. What happens? And because the force is very bad, it whips to the front again. That's where the problem starts. Of course, all the ligaments, all the problems all start from there. Now this is a serious injury because usually it's the women who get it because it's the driver who is a male, and because they are paying attention, when they brake suddenly they also tighten their muscle. So less of a whiplash injury, right? It's the female that is resting, and because of that their muscles are more passive. When they're more passive, easily influenced by forces, they push it forward, flat back. Always females are the one with whiplash injury because of that. If the female are the driver and the male is the front seat passenger, it will be the reverse. But so far, the few whiplash injury I've seen are all female because of this. So whiplash injury is very common indeed because people like to drive fast and then it breaks up. Huh?
You get good.
It depends on a lot of factors.
And it takes a lot of time.
If you rest, if you take the right steps, and if you're not too old, that means you don't have osteoporosis. Yes, with some limitation of, at the worst possible, you need to immobilize your spine. That means you got to put plates and screws and everything to fix it so you can't move your head anymore. You do that body to move your head. Right. So anyway, when you're old, it's very unstable. When it's very unstable, the only thing you can do with the spine is to mobilize it. You come to it. Osteoarthritis is a normal wear, right? A person who has to stand all the time, salesmen, hawkers and all that, their weight, hip, knee, the spine, you have to bear all those weight. And then imagine what will happen. And then you can get fractures. And so there's pain, there's stiffness, there's tenderness, there's swelling, there's a loss of flexibility, and there's a grating sense. You heard about bone spurs? Bone spurs are abnormal growth arising from bony structures. They serve no purpose, but because of the force, they stimulate production of bone, and that's why we have bone spurs. The cartilage in between the bone get eroded, symptoms continue. If you need supplements, these are the supplements to take. Glucosamine, not glucosamine alone. Glucosamine with tritine, omega-3, something called semi. This is available as a supplement for you if you have osteoarthritis. They help. What to do when you have osteoarthritis? Few things. Reduce your weight, reduce your blood sugar, eat less, exercise, and adopt healthy. When you have pain, you don't have a choice. Some people say, I don't want to take. Why? It's only kill the pain. So you think you don't have a problem.
What's the difference between osteoarthritis?
Arthritis is general. It's an inflammation affecting the
It's
joint.
also the joints.
Arthritis is an inflammation of the joint. What type of inflammation? Osteo tells you is because of the bone, friction, wear and tear. Rheumatoid arthritis is due to a autoimmune disease. That means the body attacked the joint even though nothing. Gout arthritis are due to deposition of gout crystals,
Uric acid.
oxalic crystals. So arthritis is a general term. Osteoarthritis is what is caused by wear and tear. Okay, so painkillers, you must understand, most painkillers used serve two functions. One, to relieve you of the pain, and secondly, to help you with the inflammation. Different painkillers have different anti-inflammatory action. The most famous painkillers that is used are called NSAIDs. NSAIDs. Why they are called NSAIDs is non-steroidal anti-inflammatory drug. Non-steroidal means that it is not a steroid. Why it's important to stress it's not a steroid? Because steroids reduce inflammation and cause other problems. No? So it's important it's non-steroidal. But I want you to know that it is an anti-inflammatory drug. What does it mean? It reduces inflammation, right?
So it's good to take this kind of painkiller.
Yes, you must decide whether to take or not to take. If there's a lot of inflammation and the pain is severe, you're better off taking it than not taking it.
But usually doctor don't tell you what kind of pain. You don't know. So you have to ask doctor.
Doctors sometimes are too busy, they don't explain to patient.
Yeah.
That is true of all doctors.
Yeah.
Okay.
So you say painkiller or no painkiller, I don't want to eat. Right, so you have to ask whether it's time.
So if doctors bother to explain, they'll tell you, you're better off taking. It doesn't cure, but it's better than not to take it. Because if you don't take it, your pain prevent you from doing it. It prevent you from exercising because exercise will help you to recover, right? So if you can't move, so you're frozen. But if I take painkillers, I can start to move. Movement is limited, but as you recover more and more and more, you can move more and more and more because you reduce the inflammation. This is very important. Okay, so the restricted movements, if the pain is such, and sometimes your joint get locked. Anybody who have joint pains will they can't move. The swelling, difficulty with bearing, you can't even stand sometimes. So if your nerve now next to your bone and your joints are nerves and blood vessels, and if your nerve is involved, you get tingling sensation, numbness. That's not a good sign. You better get it evaluated. And if it's soft tissue involvement, it is 6 to 8. How come I'm here? Did I miss a slide? And let me check. Yeah. Well, I was here. Bone spurs, and I was here, right? I remember talking about this. So treatment, progression to osteoarthritis can be slowed if you do all these things. And we're talking about this. Now there are 3 things. There are only 3 things, and 3 things only that will make your osteoarthritis heal completely. One, something called a growth factor. This growth factor is stimulated by a particular gene. The gene has been identified, and it produces a compound called the fibroblast growth factor 18. 18 is because of the gene involved. So this is like gene therapy. So this will allow your joint to heal. Terahertz has the potential. Radiation can reduce the joint inflammation, relieve symptoms, and allow your joint to recover. The other thing is stem cells. Stem cells and stem cell stimulants effective in regenerating the joint structure. And how it does so is that it also relieves symptoms. It also causes new fibroblasts and osteoblasts to form. It also causes a lot of production of growth factors that allows your joint to heal. I have dislocated my hip at one point in time. I have dislocated my shoulder, I told you. I have prolapsed disc. I have a lot of joint problems. I take this to recover. The Terahertz radiation also works by stimulating the production of stem cells. You can go to this. So these are the ways where you can get complete healing of your joint. So soft tissue damage, that's where we come to now. Your cartilage, ligaments, tendons, joint capsules, the fascia, the soft tissue, the sheets surrounding tendons, muscles, synovial tissue, anything that forms part and parcel of the complex your joint. And of course, That's why we talk of joint. Your movement is restricted to the point lock. You have difficulty with maintaining your posture. Now healing takes about 6 to 12. Anybody who has ankle sprain will know, right? That 6 to 12 before it heals. The way to heal, RICE. Acronym. Rest, ice, compression, elevation is so that you facilitate the drainage. Minimize use of the affected area, avoid stretch. This soft tissue damage around your joint. How do you deal with it? Make sure there are no other injuries. So you go and see a doctor, you do an x-ray. Some people go and see TCM practitioners. They try and mobilize and manipulate your bones. Sometimes you don't get well. You go and see a Western doctor and discover there's a fracture somewhere. So some of the TCM very clever now. They send you to go fracture first. Because it's very important whenever you have an injury of the bones or the joints, make sure there is no fracture, because a fracture will complicate. I know we all like to take shortcuts. Sometimes it may be the wrong cut. And if it's your spine, especially if the nerve is compressed, you may need traction. Traction, that means you lie down a bit and there is a weight attached to your leg to stretch it, to open up the space so that your nerves can be functional, so that you can have a bit of space for your nerves and your soft tissues to recover. Get therapy ASAP. Basically, it's exercise. Physiotherapy is exercise. When you exercise wrongly, you make the injury worse, right? When I first had my dislocation, went to the therapist said, you must do this exercise. They make it better. That's very important, isn't it? You do the wrong exercise, you aggravate it, you make it worse. Your injury gets worse. And as I said just now, use of painkillers, analgesic, anti-inflammatory drugs to relieve. Terahertz radiation can improve the symptoms, improve healing, stimulate endorphin release, activate neuromodulators. This is what Terahertz. That's why a lot of people report that their condition improved when they use. So when you use this, be sure to use the appropriate setting. For most things involving your joints, the middle setting, not the most intense and highest, not the lowest, but the midpoint. And not more than 30 minutes. You can start off at 5-10 minutes, depending on how you take it, and slowly increase. Again, stem cell therapy or stimulant results. And worst come to the worst, you may need surgical repair. Like for example, the example I gave was the meniscus, right? Meniscus injury. There, sometimes they need to do that. So, soft tissue injury can be anywhere, the back, the knee, elbow, everywhere. Rest, eyes, compression, elevation. On the leg, sprain, on the ankle, here, Achilles tendon. So these are the places. What can you do? Physiotherapy. Mobilize the Terahertz. Injection. In the past, we used to inject steroids. Steroids sometimes work wonders. And many years back, I had acute attack of osteoarthritis. The surgeon wanted to inject into my knee joint steroids, but couldn't do so because I was on blood thinners. I already had heart, so can't inject. Nowadays, besides steroids, we can inject stem cells. Stem cells into the knee and cause it to recover. In fact, this is one of the earliest application of stem cells. Injection of stem cells.
It's still practicing.
Huh?
It's still practicing now.
I have retired from active, but I do consult from time.
But is it still in practice?
This thing?
Yeah.
Yeah, it's still in them.
So how many jabs usually they got to jab?
Stem cells usually not more than 3 times, unless there's a very special circumstance.
Do they do it in government hospitals?
Huh?
Government hospitals, they do stem cell injection.
No.
By law, Singapore doctors cannot do stem cell.
Ah.
So the-
Only outside Singapore. But somebody told me secretly that perhaps this year it's available in Indonesia, Thailand, Malaysia,
Singapore don't have.
everywhere have. Exactly.
Why?
But, huh?
Yeah.
Ask the government, no, I'm not the government.
And is it expensive or what?
The other way is
Okay, when-
use stimulants. Stimulants cause your body to release stem cells from your bone marrow, and that do make you.
Is that the pill?
Huh?
That one? Or
Yeah,
the-
it's a pill. So there are these stem cell stimulants are effective. I myself have used years now.
This is prescribed medicine or you can buy it? Yes.
You can buy it.
How much?
From
How
where?
much?
Not ordinary
It
pharmacy,
is
right?
expensive but cheaper than this.
But
How
some-
expensive?
A month supply about 1,000.
Buy from where? Not from the local pharmacy or that.
No,
So
they don't.
online.
Is available through direct sale.
Again is direct.
Huh?
Again is direct.
Where is it manufactured, man? No?
It's concocted in Singapore
Why?
by a local doctor manufactured in New Zealand. That's the beautiful thing. That's why I like it. This person actually done research under A-Star.
Oh.
Yeah, with A-Star he was doing, so he concocted this and get it manufactured in Switzerland so that he can get the certificates of Switzerland, New Zealand and Singapore.
Oh, like
That's
that.
his strategy, yeah. So it's our own local product.
But it's not available.
Huh?
Not
It's available in Singapore.
Regular.
It's available here, you can see the boxes inside. Okay?
Let me just say approve lah.
Huh?
HSA got your approval.
HSA.
No, you don't need the
You
approval.
don't need the approval from HSA.
These are nutrition, so it's your own individual choice. Yeah. So dislocation, subluxation, partial dislocation. Every time you see a dislocation or partial dislocation, make sure there is no fracture. And you must restore the joint, reduce the joint. Sometimes it's very difficult. You're going to do it under anesthesia. So if it's repeatedly dislocate, you need to think about surgery. I have a golf partner repeatedly dislocate his shoulder. So eventually you're going to go for an operation where the soft tissues were all repaired so that it can form safe enough housing for the joint. Now that's quite difficult. Huh?
But besides surgery, how about stem cells?
Yeah, you can get it. You can improve. You can get it. Use of painkillers, anti-inflammatory drugs and so on. Terahertz can relieve pain, improve healing, all these things, stem cells, so forth. Eventually, these two work in similar ways, hand in hand. That's right. I think of it this way: this Terahertz is external, stem cell is internal. So dislocation, that's what it does, right? Ankle dislocation, not common, but it does happen. See the deformity. Knee dislocation, see the deformity. Hip dislocation, you can tell. Shortening is adducted and internally. Adducted means that it is out and it is internally rotated. In fact, when I had a dislocation of this hip, my legs, my foot was rotated internally. At that time, I don't have stem cells. I go for acupuncture. Acupuncture in many ways is similar. And one day, suddenly my leg clicked into position. Very amazing. And it completely recovered. So that was my experience of dislocated hip. Fractures. Have I covered this already?
Yes.
Bone osteoporosis. Osteoporosis is your bone get thinner. Bone injury, soft tissue damage cause pain and inflammation. Osteoporosis due to reduced bone reduced calcium in your bone, decreased bone mass, risk of falls, fractures, bone erosion. In other words, I've seen X-rays of people's spine where instead of squarish shape, the sharp corners get rounded off because of bone erosion. So a combination of this can lead to spondylolisthesis. Let me explain what it means. Your spine, the vertebrae sits on top of one another, isn't it? And it's held together by the cartilage, by the ligaments, right? So it's very stable, right? In spondylolisthesis, because of injury and because of osteoporosis, whatever, it becomes slippery. It slides on top of one another. So the sliding sometimes can be permanent. It can be slide and it stay there because it can't move too much because of the ligaments, right? But what happens when it slides? Do you know that every vertebra there are nerves coming out? That one of the reasons why prolapse disc is so important because you got tingling sensation, isn't it? Your tingling sensation is due to your nerve being squeezed. In your neck, if you have spondylolisthesis, and it does happen, your vertebrae slide on one another, and what happens if they cut off the nerve completely? Paralysis. Whole body. You have seen, who was that guy who acted in Superman? He got a fall, right? As a result of the acting, so he was paralyzed. This probably happened, okay? So spondylolisthesis is a common problem. When you have this, it is called an unstable spine, and your head of femur can fracture and get impacted. So this is caused not just by osteoarthritis, it's caused by osteoporosis. So the next few slides are all the problems caused by your osteoporosis. Let's have a look at them. So this is normal. Spondylolisthesis, your thing got to slide on one another. And then these are bone spurs. See the reduced space in between. And you can imagine nerves are coming out here. When they get reduced or it slide, your nerve gets squeezed, isn't it? Now look at the X-ray. Look at this. Totally gone, isn't it? Bone erosion. This is sliding. L4, L5, nerve gets squeezed. So lumbar spine, if your nerves get cut off, both legs cannot. On the neck, cervical spine, anything happen, all four limbs cannot move.
The bone erosion.
Is
The
the
black
bone
one, this
eroded?
one. The
Isn't
black
the
one,
bone
this one.
eroded? Isn't the bone eroded?
This two is the same, is it?
No, different. Different.
Different.
Isn't it?
But why this one is black color?
This one spondyle sliding, see? This is the effect of osteoporosis. Makes it worse. I think there was a question at Q&A 2 months ago. Somebody with this type. I said, if you reach this stage, I can't do anything. I doubt this will help. You need to immobilize it. You know how you immobilize it? Immobilize it, how to make it fixed and rigid? Plates. You put plates and you put screws that screws the plate in place. So if it's your neck, you can't rotate your head anymore. You got to rotate your body. If your lumbar, I think you get some degree of movement. You can get some degree of, but not so much. And your gait becomes unusual. It's not like the normal gait. Gait. the way you walk. So this is the effect of osteoarthritis, wear and tear, and osteoporosis. So it's very important. Now,
But then this kind of condition,
yeah.
stem therapy can stem cell.
Okay, if you start off early, you can prevent this.
But
Stem cells and Terahertz can
once
help.
it's at this stage,
Very little.
even injection.
When it gets unstable, you got to do something, isn't it? Because you can't move. Each time you move, you run the risk of paralyzing your body, you see? Which is why I think it is terribly important that people are aware of the risk. Unfortunately, not enough. And one reason after I retire why I give these lectures is because I want people to be informed that these are the choices they have. And we are now living longer. Last time, 70 as they say, they quote the Bible and say, with 70 I should die. I'm probably 74, right? I expect to live another 10 years with all this.
No, 120. The Bible says so.
It's a hope.
Pray for it.
You never know.
So, hip, as I say, is always the fracture first, then the fall. The fracture prevents you from putting weight on your leg. That's why you fall. But people think there is a fall that causes a fracture.
Oh, is it?
Not true. Fracture, yes. Oftentimes people think that way.
But it can also be the person got no strength, then fall, then got a fracture.
No. If no matter how weak you are, if you have to get up, you get. If you don't have the strength, you balance yourself and you can get up and you put your weight down. If you can't put your weight down and you fall, that's because there's a fracture already. Okay.
Me all the time, 100% like that.
Almost 100%. I can't be completely sure. Maybe there's 1 in 100 or 1 in 1,000.
And so majority is break then fall.
Yeah, exactly. Because when it breaks, you can't bear weight, and that's why you fall.
But can be also carelessness, slippery, the fall slippery or what, whatever.
If it's carelessness, right? If you get up and you can't balance yourself, no fracture, you can put your weight on it. You don't fall. Remember, your joints are to bear your weight. As long as you can bear the weight on it, there's no fracture. When you can't bear your weight, there must be a fracture. There's something happening that not only you don't lose your balance, fall as a result. That's
So
the
when
actual,
there's a fracture, but no pain, it's a line fracture.
especially when it's osteoporosis. See, osteoporosis, the spines that I show you, all the bone erosion, they complain of pain, but it was not different from the pain they had. They didn't realize that the pain was causing all these things. Okay, people are not aware. You understand? So it's a fracture that causes. And when you can't put your weight on it any longer, you have to replace the bone. That's where you have prosthesis, artificial joint. And artificial joints is used for the hip. This is made of titanium. The titanium goes down to the femur, all the way down, okay? So this is an artificial hip replacement. Knee, same thing, where if erosion of the bone occur and the joint cannot recover, the only way is knee replacement. So people ask, is it safe to want this? According to experts, yes, you can put it. This titanium, when you blow on it, will get heated up. When you blow on your muscles will get heated up, right? It's the same, at the same temperature, it's okay.
Doing this one?
Yeah.
What about this?
I should think so. The point I'm trying to say is this. Everybody is different. Everybody respond differently. I don't know how you respond. They can, but according to experts, it's okay.
The doctor asked you, putting the artificial thing, what if the natural bone deteriorates further because due to osteoporosis? They cannot hold the still, right? Another problem.
If you have to replace a joint, I hope you will change your lifestyle to make sure.
Not me, like, say something.
No, I'm serious. Take stem cells and everything to try and reverse the osteoporosis, right? What else is?
Because otherwise you'll collapse.
Otherwise, you will get worse. I mean, you got your hip replaced already. What else you want? Isn't that enough warning to do something? You understand me? It's not that you can't do anything.
No, I understand you. But
You can reverse osteoporosis. That's what I want to tell you. Not only stem cells, not only terahertz, but on top of that, your osteoporosis can be reversed because now we know that your bone is not a static thing. It's not like titanium. Your bone osteoclast is always producing new bone cells, and new bone cells are being removed all the time. There is a class of medication called biophosphonates, and what biophosphonates does is to block the activity of those cells that destroy your bone. Biophosphonates have been proven to be very active. Biophosphonates is a group of drugs.
medicine.
Yes. So if you are seeing a doctor, the doctor say maybe you should take biophosphonates. Wait, biophosphonates have some side effects. But for at least the first 5 years, you don't have side effects until after. So if you take biophysics, if you take stem cell nutrition, if you take Terahertz,
Colostrum.
huh?
Colostrum.
Colostrum also, yes.
Take before anything happened. Before we had even osteoporosis comes in.
Whatever it is, if you have this, it's a warning. And you don't want more replacement lah.
Never come to this stage. Take precaution first.
There are people who have the thing is, if you take the precautions, or you have injury when you are very young and you, because you are a sports person and your knee is gone or whatever, this is life-saving. But it also is a signal to you, okay, modern medicine can do so much for you, but some things you have to do yourself, right? And that's what it means. Okay? So there are things that you can do. That's the message I want to give you. Otherwise, no point giving you this talk. Let it come now, you know. So eventually it's a lifestyle choice. Being positive, good lifestyle habits, lower stress, be connected with people. Right? Then Terahertz will make you repair and regulate and regenerate to make you look and feel young. I think the biggest risk in life is to do nothing. I think there's a verse in Proverbs that says something like, the lazy man say there's a tiger in the street, I don't want to go out. There are always tigers in the street. If you don't want to go out, of course everything will degenerate. Right? So you have to take risks. You have to exercise. Yeah, exercise you can cause injuries. Exercise with care lah. Don't every day run for 30 minutes. One lady tried to do that, end up with osteoarthritis because too much wear and tear. Allow your body to rest. Maybe you exercise, jog or run alternate days. Maybe just 3 times a week will do. In between, if you need to exercise, do some weight bearing exercise to restore your muscle. That proof the functioning. Remember, it's your muscles and your soft tissues that support your bone. And oftentimes, the people with osteoarthritis are those people who don't exercise. So their muscles wasted, the ligaments are not strong enough to support the forces that break your joint apart, and that's where things start to go. Okay, so iTeraCare is suitable for a lot of things. Skin condition, especially pain, inflammation, any blocks. Don't use for all these things. But open wound infection can. That's the good news.
Oh, it's good.
Yes, it work for open wounds. We know that because there have been studies shown that it promotes the healing of open wounds. Okay.